Good afternoon, everybody. Again, welcome to your 5-8 EHR Miscellaneous Enhancements training. My name is Angel Burgos. I'll be your instructor for this session. Just background of this particular session. Last year we did this for 5-7, and we just made it a Q&A session where you could bring any questions table, and we'd try to answer them for you. And what ended up happening is nobody with any questions. There may have been one or two questions for an hour-and-a-half session, and it basically just turned into me talking random stuff within the application. So there, what we decided to do is to basically give some miscellaneous items that may be covered in other classes, but maybe not in great detail or things like that, just things that didn't fit into the other sessions. We decided to give you an avenue to actually to that sort of thing. So we're going to cover today. I'm hopping around here, so bear with me. I am going to share my desktop and get into the actual application. With the release of 5.8 that you'll notice is that when you go to log into EHR, you no longer see your PIN pad. Your PIN pad has been eliminated due to HIPAA requirements. You no longer have that PIN pad. The one thing that I could tell you, and I stress for you, is before you do an upgrade, make sure you have a username and password. All right. For the internal, I believe it's ngAdmin, capital NGADMIN for the login here. So we could try it. ngAd. And password is the same. Now this because I made sure before I did it that I knew my login and password for my own users that I typically would use. So I haven't used this one in a while, but I believe that is it, ngAdmin, and you could log in at that. But again, you want to make sure that you have your password set up before you go and upgrade, because once you upgrade, it's not like in the previous versions where you could turn the PIN on or off. It's just simply not available to you anymore. All right. So I set up my patient here, and I'm just looking at the PIN. That's one of the things that we need to talk about. Another thing that you'll notice or may not notice is if you go into your file option under Modify Patient, there are options here. We have now Meaningful Use 2, Core Measure 317 basically states that races and ethnicity codes should follow the federal standards published by the Office of Management and Budget. That standard basically states that the respondent shall offer the option of selecting one or more racial designations. So in this release of 5.8, we now have the capability to capture multiple races. So see here, I could select as many as I would need to for the actual race value, and they'll actually capture it on the demographics template. Now, in this particular database, I don't have 8.3 loaded, but I can show you what it looks like in 8.3 by going to a customized template that I have here. All right, so just looking for our race here. So there is a race, and this is exactly how it'll look. The 5.8 KBM templates, or excuse me, the 8.3 KBM templates, is it'll be a data grid like this. You open up, and you'll be able to see the actual races that are available, and then promote or demote depending on what you want to see over on the right-hand side. All right, look, we had a question here. Just give me a second. the same holds true for marital status. I know of. I mean, a marital status, there's no halfway in between. From a standpoint, you aren't.
The reason I asked is that this client said they had identified, I didn't ask any questions, I believe it was 18 additional statuses that they needed to add.
All right, marital status. You have.
And my question really was, can you confirm that these are by some larger entity?
Let me just make a note here, and I can get back to you. Marital status. Just here. Yeah, on that for you. Not a problem. Not a problem. There are more here than were previously. I think there's only like 5, so they definitely have added some. We'll check into that for you. So that's the big one there with the race option, making sure that you have the capability of setting multiple values, allowing the end user to document their race accurately. How about that? For meaningful use certification, we now have the capability of still staying along the same lines of capturing multiple data elements for the support role. Here under your relationship, you'll see a new section down below for your support role, and you actually go in there and document what their support role is. So previously, you didn't have the capability in this section. I'll show you a screenshot. But now you could add all 3 of them, or you could just say that they're the next of kin, or are they the caregiver and the emergency contact. So what it looked like previously, and I apologize for the hopping around, but it's the easier to show you. In 5.7, this is what it looked like. You had your relationship, which was fine, which is the information that you've seen at the top, but then below you have this particular section. You now have that capability within the actual application. A little caveat with that support role, basically just stating that this information in different demographic areas, and this does not link up with those other demographic areas, so you have to be careful when adding it. I assume that at one point they will update that, and you will be able to get to it. Where you do one change and it fixes it across the board, so to speak. We now have procedures, a couple things that have changed for the procedures module. One being is that the units now have the capability of adding times. This is for behavioral health. So if they needed to, they could actually document half hours on counseling and things like that. We also now have the capability of adding up to 12 diagnoses that will actually be sent over to EPM through the super bill. As you can see here, they have different values that you can add up to. Diagnosis is also utilizing the listing or the billing side of the search engine in the problems window. Automatically pulls in what current diagnosis this patient has in the chart, so you'll be able to select from that as well. In 5.7, it wasn't something that's new to 5.8, but in 5.7, we were in the ability to use NDC IDs. So we want to just point that out, that we do have that capability. A lot of people didn't realize or Didn't see that we had this capability, but we do. The library has to be built in file maintenance. That is one caveat. And I had built here, but like it doesn't, like it's not pulling in. All right, so I do have some values in there pulled forward. It just allows for the billing purposes of those particular codes and those NDC IDs. Previously, the EPM side had the capability of doing it. We were given the capability of doing it in 5.7. We have the capability of building this into TriggerWorks. So that's again just a little thing that I did want to point out. Your RX on file was again another 5.7 enhancement. If you didn't notice, we now have a new patient information bar up at the top, underneath the top toolbar. You do have to turn this on, but you'll see here certain demographic information that's relevant to that particular practice. This one's a little bit messed up. I'm not exactly sure why it's not working or functioning as designed, but it is missing a few things. I'm not going to go back to my other database to show you how it looks correctly. Let's see if I have a screenshot of it. So I'll show you a screenshot of it after we talk about it. You can turn this on. It is a file maintenance option that you turn on in your practice preferences. So here under your practice, you select your particular practice that you're interested in turning it on for. You'll see your preferences. Simply click on that. Along the left-hand side, you'll see your preference list. If you go down to your through your preference list, you'll see something that says Patient Information Bar. Then out of the box, mine was actually turned off when I first received it, so you had to come into this particular section and turn it on. So I was seeing it in all these trainings. I'm like, okay, well, where is it? How do you turn that on? And then finally, somebody actually sent me an email saying, hey, you got to turn this on by going into practice preferences. So I didn't want you to be in the same boat, so here it is. This is where you turn it on. You can see here there's patient demographic information. This is hard-coded information that you could pull in. So you could select up to 3 different values. Those 3 values will be available to you in the EHR right here in the middle section. All right. Below you'll see your template customization. Here I have the PHI log. So if you go back in the EHR, you'll see the little icon here that allows me to easily navigate out to the PHI log. One caveat that I do want to mention with these customization values down here, that it's all demographic information and demographic information only. Right? So just keep that in mind. If you open this up, you're going to look at it and you're going to be like, okay, well, where's my allergies module, or where's my medications, or where's my intake template? I can't find any of that. Well, it's just demographic templates only. So keep that in mind. That's all that's going to display there. Then below you have your template fields. This allows you to actually navigate out to a demographic template and find relevant information that you're looking for and pull that data directly onto your EHR. Here you see weight in pounds and the person ID. Somebody said that they needed it, so we put it on there for them. So just again an example of seeing information. Pretty much up the setup of it. Go over these allergies, and I'll hop into the PowerPoint so you can see the actual items that are missing. So up here at the top, you see your allergies, problems, diagnosis, and medications. This allows us, or gives us, the ability to actually view into those particular windows without actually opening the module. So you could be anywhere in the template, whether you're on a module, whether you're on a template, whether you're adding medications, it doesn't matter. You come in and just simply look or hover over the numeric value and see exactly what that patient is allergic to, sitting with your problems. You could hover over it, diagnosis as well as medications. What's really cool, though, is that you can come in and actually click on the numeric value. Now, if you click on the word, it's not going to do anything. But if you click on the numeric value, it will actually launch that particular module. So here it just launched my allergies module for me. I can go into my problems, directly into my problems tab, Or if I went into my diagnosis, I can go directly into my diagnosis tab. It's entirely up to you which way you go. But instead of having to hit the history button and then go back into your tools or moving these icons into your toolbar at the top, you could just simply look at it, and if you wanted to do something within there, just simply click on that particular button. All right, let's go to the PowerPoint. So as you've seen in mine, I was missing some items. Along the left-hand side here, you'll see the email, the telephone template, the task or to-do, and then your patient tracking options are there. This information was previously available to us in the left navigational toolbar. Now it's in our patient information bar. Your address there, some alerts. If it's a patient, you'll see your GYN details there. Again, we already talked about the demographic information. What I wanted to point out is here next to my PHI log, you'll see all that information that was once readily available to you on your intake template is now in your patient information bar. I didn't mention this previously, but you can expand or collapse that particular information within your information toolbar. So just niceties, so to speak, within the actual application, make it easy on your end users. They can navigate back and forth. And again, here you can see the real estate that it takes up. If you collapse it, doesn't take up much. And you could expand it, and you could see all the information that you need and just go right back to working. The allergies and problems, diagnosis, and medications will stay open. You will still see that Reddit general information for your particular patient. As you may know, we have a new diagnosis module or problems module. In the module, it's now broken up into two sections. You have a problems list and a billing list. The problems list is your SNOMED codes. Your billing list is your ICD-9 or 10 codes. But with this, it has brought on new reports and report capabilities. So we just want to talk about the reports. How you get to your reports is under File, Reports, and then you could generate a report, whether it be enterprise or practice. Doesn't really matter. It'll open it up. Within that particular section, once we open it up, you'll see here that under Diagnosis, you have the capability of reports based off of a chronic value. Under Search Engine, it's actually search based off of all categories. So that's a new enhancement as well. Down you'll actually see a problems option, which is all brand new. All right, still has the look and feel that you would find similar to your diagnosis. Just the search engine is going to give you the search engine for the SNOMED codes, the SNOMED values, and you'd be able to pull that information in and run a report if necessary. Again, your filters are all the values that are available to you in the actual module. A lot of times when we're talking about running reports, we want somebody to run the report that knows how the module is actually being used, and not just from a overall use standpoint, but at your particular practice. You know, understand whether or not you add clinical status into your patient's charts and that relevant information to run a report based upon. You know, it's completely up to you. So just keep that in mind when running the report. And there is a new option here, save your report. Down here, the save results for notification. This option allows users to save values to the background business processor, which will in turn connect to the patient health application. Again, one of those things that because of the patient health, we wanted to be able to run reports for the patient health, and this is how you would actually do it. All right. We're on our last call. where we covered clinical reconciliation. Some of you were not. I do the issue dealing with development and their QA environment, and I usually go to demonstrate the reconciliation tool or utility, but I'm still not having any success. I'll try it one more time. See if I log in here. Be able to show clinical reconciliation, your clinical reconciliation utility. If not, we'll do a high level. Again, there is another class for it. It is recorded. It is out there where we actually use the live environment. No, it doesn't look like it's doing anything. So we're still receiving the error. So I apologize about that, that we can't demonstrate that. But let's take a look and just high level it. So for clinical reconciliation, basically comes down to meaningful use requirement that states that you need to be able to reconcile your medications, your allergies, and your problems list. All right, so those three need to be able to reconcile. In order to reconcile that particular information, you need to have EHR complete set up and be capable of running the medication history so you could receive the SureScripts values so you can reconcile the medication module or medication information. The second fix or utilization of it is the EHR Connect bundle. The EHR Connect bundle will allow you to import your continuity of care documents or CCDAs, those continuity of care documents, into your actual application. Although I can't show you the actual live environment, I can still show you the application. You have three ways of navigating out to it. You can click on View, Clinical Reconciliation. You go into an actual module, and a module. Now, if you do it from the View Clinical Reconciliation, it's going to open in View All mode. This will allow you to actually document and navigate through all 5 of the tabs for reconciliation purposes. If you do them in a module, you're only going to be able to navigate within one window that you're actually using. So we have our medications. If I click on the actual reconcile button here, it'll open it up. And you'll notice that everything is grayed out except for the medications module, allowing me only to manipulate the medication. So this is in module view only mode, and then if I go into my view clinical reconciliation mode, it'll show me the entire, so now I can just navigate across each particular tab. All right, so up at the top under your view option, you see raw XML information. All right, so it's just going to show you your XML data that's being imported based upon the CCD document or CCDA document that you imported. So here under your clinical reconciliation, under your documents, you'll see an orange tab that'll say HIE documents, or you'll see an orange tab that says SureScripts. That information is based upon whether it was pulled in from a RIO for your HIE documents or pulled in through the history in the ERX from SureScripts. Then you'll be able to see the raw information. Your import, you've already kind of seen. Your reconciliation history is almost like an internal audit of anything that's been imported or any steps that have changed from the imported side. To the top, as I mentioned, there's 3 that are required for meaningful use requirements. That's your medication, medication allergies, and problems. The items that are going to meet the affect the numerator and denominator, there's going to be a checklist, and there's three things that are going to affect that, and that's usually what the clients want to know. They are a new patient, so a brand new patient comes over. Clinical chart summary information is pulled over, so that means that you've generated a CCD, or CCD has come into your system. You're reviewing, comparing, and contrasting that information, or a hard copy CCD value has come in. The patient carried that information in. Now, this information is going to be met by a check mark. Right now, the check mark is available on the 8.3 kbm under intake under the medication module. I had enough time in the actual kbm to be able to tell you exactly where else it is. I would assume that it's near the allergies as well as somewhere with the problems on the actual template. But again, I haven't had that much interaction with the actual KBM to this point to give you an updated answer on that. For your medications, you'll see some provider demographic information, who's currently logged in, the patient demographic information, your reviews. Basically saying who you actually reviewed the documentation with. The meaningful use requirement states that you must have two separate lists you could review. Here are two separate lists. You see your import list and your EHR list. Your EHR list is exactly what's coming from that patient's chart in EHR. So in his medication module, all under inactive status, all of these medications. The imported side is going to be whatever is pulled in via SureScripts or your CCD. So if any information, any medications that come in, you'd be able to see that information. Then the second part of the meaningful use requirement states that you must be able to compare and contrast in a single list the information before you validate it. And a single list is going to be down here under your reconciliation summary. So when the imported data comes in, you'll be able to either add nothing at all, or add or replace those items from the imported list. Once you add any values from the imported list, it'll then reconcile down here at the bottom and add it to the summary. The summary is like a snapshot into the EHR after you confirm the information. One thing I must point out about this is that it is directly linked to the actual modules. So if I came in here and I decided that I wanted to stop and or delete a value from the medication module, I could do that here. And unlike the telephone template where you would have to document it here and then go into the actual module and do it again, if I stop something here, it's going to stop it in the medication module. If I delete something here, it's going to delete it from the medication module. So you have the capability of doing this on medications, your allergies, and your problems. Medications will run the drug utilization review for you directly from here. Your other ones, such as your allergies and problems, may not. The medication allergies have updated. I really think that they have. I still haven't had a chance to reach out to anybody about it yet. But the med allergies previously you weren't able to run the DUR, but it looks like they've fixed it in this version of 5.8. So just keep that in mind. In the other ones, like the problems, the DUR check doesn't even exist. On the diagnosis codes, you'll actually have to go into the module after you completed or confirmed your data and put it or run your DUR check. Now, I didn't mention this, but you must complete a task, completely confirm it before you move on. So if I made a change here, you'll see the little star at the top there indicating that I've made a change and I haven't saved it yet. If I try to navigate out, that's when I'll get this warning and none of my changes have actually saved. As I mentioned to you before we started talking about this, there is a full session on it. I'm not going to get too much in the weeds here, but I did want to give a high-level overview of the reconciliation module. Another way that you could launch this, and it's via a trigger on your templates, and when you get to 8.3, The KM, you'll be able to launch the reconciliation module from wherever we had the capability of launching the medication reconciliation in previous versions. You also create or customize your own section to launch it as well. So I go into my template. Let's see. I think I'm here somewhere. Alright, so just created a trigger. One thing that I want to point out with the triggers, if you create it, it will actually launch in view all modes, so you'll be able to navigate across each and every tab. Now, your diagnosis codes and procedures are not required for meaningful use, just the first three. Just wanted to let you know. Alright. There have been some enhancements to the PAQ. Some of them we could see today, and some of them we will not be able to see, but I just want you to know that they do exist. First one is the ability to send equipment reports, such as EKG, pulmonary function, and some of those values. Those external systems that connect to ours, that run their own reports, can now put those into the PAQ. You also send Rosetta documents into the PAQ. So for those that know Rosetta, the Rosetta holding tank and things like that, we can now send those values into the PAQ. And then probably the most important one or significant for us as end users, we now have the capability of viewing items across practices. Now, there's some setup that's required for this. In System Admin, oh, if I can click the right one. In System Admin, go into your provider level and your rights on operations and scroll all the way down. You'll see PAQ tab. All right, been there for as the PAQ existed, but there's a new option here: view items across practice. If you click that, this is your rights to allow you to view items across practice. Right, so that's the user level. You also have a universal preference to actually turn this on and view items across practice. Relationship for the actual provider must be self. All right, see the relationship for that provider, it must be self, and it must be part of the actual practice in file maintenance. So file maintenance, if you look at them, you have to make sure that they are part of the actual practice. So you can go in, take a look at your providers, alter ego here. Click on the practice, you can see what practices they have access to and or are part of, and there you see it. So those are the options that you have to have set in order to utilize it. Then once you're in the actual application, here I'm logged in as the NG admin, so I'm not going to be able to do anything with it. I'm not going to be able to see outside of my scope for the queue. What I mean? All right. So when I come in here, if I click, even though I'm associated with Barry Anderson, I click on the drop down for my practices, I can't navigate across practices. Log out in as Barry Anderson. My PAQ. You'll down here, I now have the capability of changing my practice. So I have all my community and my specialty. Well, why ain't I seeing the other values? If you've just seen it in file maintenance that I multiple values, the reason being is because this user is only a user in system admin. You could utilize them as a provider in file maintenance, but here they actually have a relationship of self in system admin. So here, if I click on all, you'll be able to see that this addendum, it comes in italicized. So one value that's part of another practice that pulls in that information. If I go back to next gen medical practice, it'll streamline it just to next gen. If I go into the community, there was nothing in the community, and Only the multi-select, just basically saying that the document doesn't exist anymore. But the big thing for the PAQ. What question? I heard some feedback there while I was talking. I apologize. Okay, moving on. Something that I can't really show, but we could talk about the import CCD information. See, you're only going to be able to utilize XML format only now. I believe we were able to use style sheets previously and some other items. Now it's XML format only. You can only send one CCD per message, one CCD per HL7 message. It's now stored in its own HIE document table. NCDs will display in their own category. If I had any, you would see the HIE documents and sent is where you'll see those values show up. And I'm not able to do anything because I'm not hooked up to the actual HIE. But I do want you to know that under the HIE consent, it's no longer a pop-up. It's actually utilizing a module. All right, it's going to be a modular effect now versus a template pop-up. Now some cool things that they've done with the orders module. In the actual orders module, they now embedded the immunizations. This is reliant upon 5.8 and 8.3. You'd be able to see the immunizations here and be able to see all the information and everything else. There is a class for that that we are performing sometime this week. I don't know if it's tomorrow or the next day, but that's a full-on session. But just understand that they have embedded the immunizations into the actual orders module now. What I want to talk about is so the vendors. Previously, when we went in and we went to the new orders, you would see up here a full laundry list of. Well, we could streamline those vendors to the vendors that we want to see. So here it's showing all of them, and in Lab I'm only seeing one. That's because I set up to do so. So where does this actually get set up? It is in File Maintenance under your Practice Preferences. This I will go into. This left navigational toolbar, preference list. You'll see the Orders Module section here. On the Orders Module, if you go to Lab and RAD, you'll see here your performing entities. So your selected performing entities, this is basically a list of the values of the performing entities within your practice. What do you want to see? You see here, radiology, I don't have anything selected. That's why I was able to see everything. With nothing selected, you see everything. With something selected, you're only going to see that value. Here are your preferred performing entities. This is going to default, basically saying that those are the ones that you want to use. All right, so keep that in mind. You'll have the ability to overwrite it at the payer level, and we'll talk about that here in a second. Here in the actual application, there's some other options, and we'll talk about the payer level option here in a second once we get there. But I want you guys to understand that we now have the ability to use medical necessity for non-Medicare patients. So if this provider or if this particular payer wants to accept the same medical necessity rules that Medicare utilizes, you do so, and I'll show you how to do that. So let's first take a look at an example here. Let's see, we get a lipid hypertension. Let's go with, do we have it here? Hypertension, go with a lipid panel. All right. I checked my medical necessity. Insurance selected does not follow Medicare rules. So it's basically saying, hey, you follow Medicare rules, so why are you trying to run a medical necessity? All right. Whereas if I go in and I actually turn it on, which is turned on in file maintenance, and at the payer level. So I payer, and I always pick on Blue Cross Blue Shield of California. And you'll see a tab over here for orders module. Open that up, I'll be able to select. So remember I mentioned to you that we have the ability to select a default, a general default at the practice level. Well, if that patient has this particular payer, these values will overwrite the information that's in the orders module. So you'll have core and orchard as the main values. But what we're interested in here, this was just a little caveat, what we're interested in here is the medical necessity. So you follows Medicare rules for medical necessity checking. So here you can click on follows Medicare rules for medical necessity checking. That'll turn it on. And you have the capability of applying it to all payers within the same financial class. So here within sorry, I always miss it, within the system, we have the ability to determine what payers follow that specific financial class. So basically it's saying that if we select that bottom check mark, anybody with the financial class of BCBS will fall into that. It's you. ABN report, where does that report live that you want to generate? All right. So you may have to go in and find it and navigate out to where that ABN actually lives. A lot of times it's in the components folder. I'm not really worried about it for right now. I'll get an error, but I'm not, again, really worried about it. All I care about for right now is showing you guys this medical necessity option. So I can close, may have to close out or log out of my application completely. It's not going to hurt. All right, if I go in, what I say, hypertension, lipid, oh, it's going to make me close all the way, isn't it? Sorry, need to be re-registered when you make changes, and this is one of them. This is Orchard for my radiology, and my lab is LabCorp based upon my settings that I just had in file maintenance. So just want to link that out. There. So here it's just basically saying that it needs a waiver. If you click on this, it's not going to work because it's have it. But that's all based upon the insurance that we just changed and basically said that we're looking for this to be utilize the same medical necessity rules that Medicare uses. So again, you can now do that at a payer level. So again, pretty cool functionality and features. Yeah, I'm going to use it anyways. As a provider, logged in as a provider with a relationship of self, we can now the meaningful use attestation screen. And it's under your view menu here, and you'll see the action. Basically show you all the information for that patient, whatever the information that's relevant there, the things that you need to see. Is there for the actual payers. Again, just some information that for meaningful use 2, certain data needed to be encrypted behind the scenes. And there's a bunch of information, anything that has to do with the background business processor, file maintenance values, EHR, the modules, the our next-gen log, all this information needs to be encrypted now. Where previously the log files, you were able just to go into them, now they're all encrypted. Medical summary, any interfaces, Rosetta Holding Tank, Rosetta Management Console, Rosetta Network, and the log folder, all that needs to be encrypted now for meaningful use. Some other things that I just wanted to point out. It's not really a 5 thing, but it was a 5-7 thing that some people just weren't part of the company at that point, or whatever the case may be. Your communication tasks are in a single window, and this is basically when we went from 5.5 to 5.5, they lost some functionality, and people want that back. So in 5.5, we gave them the functionality back. So now they have the medications by problems list, the medications by payer list, so they could actually go in and create these lists that want to search for medications by. So we just want to point that out, that you do have that capability now back available to you, and it's been available to you for over a year. We rolled that out with 5.7. I just wanted to point that out for you. Or not, that is it.